Hello everybody, this is Dr. Stefan Buntrock from UroChannel. For those of you who have watched my channel, you know that I'm a urologist. Sometimes I upload content about urological conditions that hardly anybody watches, but I think it's important for everybody to know anyway. And I try to keep you happy by adding some stuff about penis size and semen and testosterone once in a while. On February 24th, war has come to European ground, and suddenly creating content on penile dimensions doesn't appear appropriate anymore. Only 2 hours flying time away, bombs are falling on Ukrainian cities. Women and children flee the country while men are staying to defend it. It is more than likely that there will be cases of massive trauma and casualties also among the civilian population. The question is, how much medical help will there be available when chaos takes over? I don't know, since I don't live there, but I want to help. In my early years, I received some training in trauma care to be able to be on call for the surgical department I was working at. Therefore, I will be uploading content on basic principles in trauma care for the average person who has never had to deal with these issues, because it may be possible that no doctor is within reach. Sometimes lives may be saved by doing the right thing immediately until professional medical care can be provided. For this, I will also need your help. Please share this and the following videos so they reach their addressees soon. And by the way, I will be donating all revenue from this and the following videos to the Ukraine Humanitarian Fund of the UN. Thanks in advance for your support. Now, let's get to the topic of this video. It is about injuries due to burns which easily can happen in connection to Molotov cocktails, explosions, etc. In the burned person, it is important to stop the burning process immediately. When synthetic fabrics catch fire, they not only burn at high temperatures, but also melt down into a hot residue that continues to burn the skin. Carefully remove the involved clothing. If there are any chemicals on the wound, gently brush them away and avoid direct contact with the chemicals. Then rinse the affected areas with lots of clean water. I mean, lots. Do this for at least 20 minutes. But be careful, if there are extensive burns, cold water will cause body temperature to drop. We call this hypothermia, which is a life-threatening condition. Then loosely put cling film around the wound and/or a plastic bag on. This will reduce the risk of infection, keep air off the area, thus reducing the pain. There are 4 degrees of burn injuries. In first-degree burns, the skin is red and hurts, but no blisters are seen. They are characteristic of second-degree burn injuries. If blisters are visible, leave them, don't open them. Intact skin is a good protection against infections. Third-degree burns appear dark and leathery. The skin might also appear waxy white or translucent. The surface is also painless when touched. Third-degree burns will need surgical intervention and skin transplantation and will not heal by themselves. In fourth-degree burns, muscle and bone may be seen and there is carbonization. Be aware that the lungs might be affected too, especially with explosions. In case of facial burns, burned eyebrows and nasal hair, inhalation injury is very likely. Especially when you notice difficulties in breathing and wheezing sounds. It is urgent to get the wounded into the hospital as soon as possible for intubation. If this is not possible, you might have some asthma or COPD medicine at home. Asthma sprays make it easier for the air to pass. If you have cough medicine at home that is called N-acetylcysteine, it will be helpful in clearing the airways. Perform deep breathing and cough exercises with the wounded every 2 hours. If you can get hold of oxygen, put a mask on him and let him inhale 100% oxygen. Another very important point is volume support. The body is in need for increased amounts of fluid. This is absolutely important with burns over more than 20% of the body surface. To assess the burned area, the rule of 9s come in handy. The body is divided up into regions that represent 9% or are fractions or multiples of 9%. Here's a picture how to calculate this for adults. Establishing intravenous access with a needle is very difficult if you have never done it before. So instead, drinking slightly hypertonic fluid is the next best thing. Mix 1 liter of water with 8 teaspoons of sugar. Add half a teaspoon of salt and half a teaspoon of baking soda. That makes a slightly hypertonic solution that will replace the loss of salt typically occurring in burn patients. The fluid needed in the first 24 hours calculates as follows: 2 to 4 milliliter per kilogram body weight per percent second and third degree body surface burns. You will give 1/2 within the first 8 hours from the time of injury happened and the rest within the next 16 hours. For example, adult 80 kilograms with 15% burned body surface. That's 160 to 320 milliliters multiplied with 15, which equals 2.4 to 4.8 liters of the solution I just mentioned within the first 24 hours. How much should be given depends on the individual occasion, because you don't want to overhydrate the patient either. Look at the color of his urine. If it's light yellow, you're doing a good job. If it's dark yellow, he needs more. And if it is white like water, well, that was too much. Once again, think about hypothermia. Warm up the fluid to body temperature if possible. Remember to keep the patient warm at all times. If you have any questions, leave them in the comments down below. And one more thing, this video is not a medical consultation, but my advice what could be done with limited supplies sitting at home at war with no access to medical help. Should you sustain burn injuries in a country with an intact infrastructure, seek medical help immediately. Thanks for watching. Bye bye.